Inguinal hernia, basic facts about treatment of inguinal hernia for general public. An inguinal hernia occurs when tissue, such as a part of the intestine, protrudes through a weak spot in the abdominal muscles of the inguinal region. The resulting bulge can be painful, especially when you cough or lift a heavy object. The only treatment available for inguinal hernia is surgery. There is no medical treatment for inguinal hernia. Inguinal hernia, if not treated, can lead to intestinal obstruction. If the content of the hernia is bowel, and if the bowel gets stuck in the hernia, this can have bad complications like intestinal obstruction. If not treated immediately, this can even progress to something called as the gangrene of small intestine, and this is an emergency condition. Surgery for inguinal hernia can be either a laparoscopic surgery or an open surgery. A laparoscopic surgery involves creating small holes of the size of 5 mm to 10 mm and operating within these holes. It is also called as a keyhole surgery. The traditional way of repairing the inguinal hernia is an open surgery. Both laparoscopic inguinal hernia mesh repair and an open inguinal hernia mesh repair have very good results. But the latest development is to do inguinal hernia completely laparoscopically. So laparoscopic inguinal hernia repair has the advantage of decreased post-operative pain and early return to work. Inguinal hernias are always repaired by using a mesh, except in certain emergency conditions wherein we do not use a mesh. The mesh is made up of polypropylene. It is an inert material and it does not cause any reactions with the body. The recovery time after laparoscopic inguinal hernia mesh repair is as less as about a day or two. The patient is discharged by the next day after surgery. He can join work after 2 to 3 days post-discharge. There are no special restrictions after inguinal hernia repair. Basic few restrictions would be to avoid doing any kind of exercises for the next 2 to 3 months. Bending and lifting heavy weights should be avoided. Otherwise, the patient is free to carry out his day-to-day activities. My advice would be kindly get a surgical help if you are suffering from inguinal hernia. These are best repaired by laparoscopic surgery. Thank you.